I think that we have to see where they're at in 2 or 3 years, see if they sustain that weight loss. My big concern is that you cannot circumvent the required lifestyle changes that it takes to keep the weight off. Medication that will augment your feeling of fullness and cause you to eat less food, and then you will lose weight temporarily. There have been known to be rebound effects when you stop the medications, rebound hunger, rebound eating.
All right, y'all, I'm here with Dr. Morgan. Thank you so much for joining us today.
Yeah, my pleasure. I'm excited to be here.
Me too. Okay, so as I mentioned in the intro, you are the go-to expert on all things insulin resistance and all things like surrounding that topic. So I kind of want to start just giving the basics for people. I know we hear about insulin, we hear about blood sugar, how we should be concerned about it, all that stuff. Can you explain what insulin resistance is, like how that's different from full on like diabetes or pre-diabetes? Like what does that mean?
Yeah, so insulin resistance is just when your cells become resistant to the effects of insulin. And so insulin is a hormone made by your pancreas, and it has a lot of different jobs, but the primary one I focus on is blood sugar regulation. So when your cells become resistant to the effects of insulin, it's harder to get the blood sugar into the cells, which means you're going to see higher levels of blood sugar. And I like to just describe insulin resistance as like the railroad track. And whether you have pre-diabetes or type 2 diabetes, it's just a stop along that railroad track. And the problem with just testing glucose or just testing hemoglobin A1C is it doesn't give us an early enough heads up on the problem. Glucose and A1C are really downstream effects of the degree of insulin resistance that you have. So if we can check fasting insulin, again, that hormone made by your pancreas, check your fasting insulin. See, is it high? Is it low? How am I doing with it? You're going to have a 10 to 20 year heads up on a diabetes diagnosis. Again, that takes 10 to 20 years before your glucose or before your hemoglobin A1C will rise. You're going to see that insulin rise in the background. So I think it's a really valuable, really affordable test that you can get. Like you can ask your doctor to order you an insulin test if they're not very supportive or they don't really know what you're talking about, or they're like, oh, we only do that for diabetics.
Right.
That's okay. That's a sign you should probably get a different doctor, and you can order it on your own. So you can go to testing.com and you can order one to get from like a Quest or a LabCorp near you. We have at-home insulin test kits. It's just a finger prick. It doesn't hurt. Send it into the lab, you get your result back. But it is important to know your fasting insulin level.
That's crazy. So we could essentially know like 10 to 20 years before full on pre-diabetes, diabetes starts. That's crazy. Like that's
Yeah.
that's huge.
Oh, so many people have a false sense of confidence, a false sense of security because they're not that bad yet.
Right.
And unfortunately, in 2023, the American Diabetes Association even like raised the bar for what they consider a healthy A1C. And essentially they say, oh, it's okay if you're a little bit diabetic.
Right.
And it's really not. Like my
Yeah.
dad's a type 2 diabetic, and his doctor gives him false confidence all the time because he's like, well, my doctor's happy because my A1C is under 7. And I'm like, yeah, optimal is 5.5, Dad. We have some work to do,
Yeah.
Mom, because she's really the one in charge.
The caretaker. Yeah.
Yeah. Yeah. So I think it is so beneficial to not lie to yourself. And I
Right.
do hear this a lot, like especially with these GLP-1 drugs on the market right now, and some of the insurance restrictions that we're experiencing with those, like insurance doesn't pay for them for some people, for some types of insurance, unless you're diabetic. I've actually heard 2 people now say, well, my doctor said like, if I just, you know, get my A1C up a little bit more, then I'll qualify
My
for these medications.
gosh.
I'm
That's
not kidding.
insane. That's
It's
insane.
insane. But that's how people are thinking. People are trying to manipulate the system to get a
Right.
drug to fix their problem, and a
Right.
drug is just a Band-Aid.
Right.
So it's not a long-term fix. It's not a solution.
Yeah.
It doesn't fix insulin resistance.
Right.
So we really want to get to the root cause, which is insulin resistance.
Right. Right. So if you, okay, so you're you're testing your fasting insulin levels. Like that's the test that you're like, that's like the pre whatever. So, okay, so let me ask you this then. So at what point should we be testing that? Like, is there a certain age, a certain stage of life? Like, when should we
Yeah.
start looking at that?
I think adults, I don't really speak on pediatric care. That
Sure.
is not my I'm
Yeah,
actually a
yeah, yeah.
geriatric specialist.
Yeah.
So, I think 18 and older, but more, I mean, childhood obesity is on the rise. There's
Right.
absolutely no doubt that levels of type 2 diabetes in children are on the rise.
Right.
It would probably be wise to be checking it in children, but the cutoff for adults that I recommend is we want your insulin less than 6,
Okay.
fasting insulin less than 6.
Fasting insulin
18 and
levels.
older, tested every year,
Yeah.
should be part of a standard blood panel, a
Mm.
standard wellness exam. It's not, it's one of those things you're going to have to ask for.
Which seems so crazy. It's like the easiest thing to test. Like, I feel like that's such a crazy thing that's not like part of the normal blood panel situation.
Doesn't make anyone money. Like
Yeah.
it
Yeah.
doesn't, if we can stay healthy, then doctors get less money and pharmaceutical
True.
companies get less money.
That's
And
so true.
so,
So is that considered like preventative care then? Like that's not even that's crazy town.
yeah,
That's just
yeah.
crazy.
And a lot of physicians don't understand the value of
Right.
checking fasting insulin. I've had
Right.
clients tell me, like, I tried to get my doctor to get it for me, and they said they didn't even know what it was. And so they asked people in
That's
endocrinology, and people in
problematic.
endocrinology were like, well, we only check fasting insulin if someone's a type 2 diabetic.
My
And
gosh.
it's just, I
Well, then
mean, I
it's
like
too
to,
late.
it's
Like,
too late. Like,
yeah.
that's the point. There's another client who was wearing a continuous glucose monitor. She's a nurse, and she works in a hospital, obviously, with physicians. And the doctor's like, why are you wearing a continuous glucose monitor? You're not diabetic. And she's like, because I don't want to be.
Right,
Um,
exactly.
this is crazy.
Exactly.
So I think that fasting insulin is great. I also really do like continuous glucose monitors.
Mhm.
I don't know, 14 weeks pregnant right now. And so it's been
Oh,
really,
congrats.
thank you. Yeah, this is number 3. So,
Oh my gosh.
my, yes, my life will change a lot here in April, God willing. And, it's been so interesting to see how my glucose regulation has
Mhm.
been immediately and pretty significantly affected by
Yep.
pregnancy hormones.
Yes.
It's a state of physiological insulin resistance. Like,
Yes.
my body is wanting to be more insulin resistant to allow
Mhm.
more glucose to be in my bloodstream to go to the fetus to help
Right.
them grow. And I'm like,
Right.
yeah, 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 I get that, body, but
Yeah.
also come on. But it's been good to help me, like, dial in my nutrition and
Yes.
hold myself more accountable. Like, I think continuous glucose monitors they bring future consequences into the present moment, right? Like,
Mhm.
diabetes takes decades to develop, but you can have a donut and see your blood sugar spike and be like, don't want to do that again.
Right.
Or you can, a lot of people are trying, like, they're trying really hard to eat healthy, but the
Mhm.
problem is what they think is healthy is not actually
Right.
healthy.
Right.
I had a Subway sandwich the other day, and I'd never had one of these with a CGM on. And it had like the 6-inch wheat, double turkey,
Uh-huh.
got my protein
Love the
in,
protein, yeah.
cheese, yeah, but my blood sugar went from like 94 to 170.
Oh my
And
gosh.
I'm like, well, that's not going to happen again. I guess I'll get
Right.
a salad with all this same stuff on top, not the bread. But you don't know unless
Right.
you have that data. And so it's a really
Totally.
great tool. It overwhelms some people, like,
Yeah.
all of it overwhelms some people,
Yeah.
but if you can just kind of have a curious mindset and just
Mhm.
take it meal by meal, and, well, how did this amount of carbohydrates
Mhm.
impact my blood sugar? And,
Right.
well, how does walking after a meal impact
Yep.
my blood sugar? And take the pressure off of yourself to understand every little thing. It's super
Right,
helpful.
right, right, right. No, that makes sense. So I would love to know if so I had gestational diabetes with both my kids, and it
You
was the
did?
most annoying thing because I consider myself very healthy.
Yes,
And
I
I
would
work
expect
out all
that
the
of you
time.
too.
I own a fitness studio. I eat super healthy. Like, what is anyway? So it was like a running joke with my gynecologist. She's like, "Oh, my healthiest patient is, whatever." So I would be, and it was, I agree though. So, I had to do the finger prick thing all the time, all day, every day. And it was interesting to see, because I agree, like you, like how your blood sugar is affected by certain things. And um, like, first of all, I think it's just cruel to tell a pregnant woman she can't eat carbs or like to limit her carbs. So the whole time, like, this is torture. Like, this is terrible. So my heart goes out to all of you who have had gestational diabetes because it's not fun. But my question is, so if you're like looking for a way to like check your blood sugar, monitor it, do you have like a pros and cons type thing for like the finger prick situation versus I mean, obviously I know the continuous glucose monitor is easier because you don't have to do the finger pricks and that whole thing, but
Yep.
is there pros and cons in terms of like accuracy or the data it's collecting, that kind of thing?
Yeah, there is a margin of error,
Mhm.
and it can be a little bit wide, depending. There are ways that you can calibrate a continuous glucose monitor. I really like I've had the best luck with the Freestyle Libre 3 from
Okay.
an accuracy standpoint, usability standpoint. But you can calibrate it where you put the monitor on and then you prick your finger and then you manually enter what the glucose is, and then you do
Gotcha.
that like 2 more times, and that helps with the accuracy.
Okay.
I really much prefer the continuous glucose monitor if your goal is to help you identify how what you're eating like affects your blood sugar, and if you're eating more carbohydrates than maybe what's ideal for your
Mhm.
body. So according to Levels Health, that blood sugar rise after a meal shouldn't really be higher than 30.
Mm,
So if my pre-meal glucose is at 90, then at any time after the meal, my blood sugar ideally should not go above 120, right? 30 more than
right.
90. And if you're going to do a finger prick, well, that's at least, I don't know, 3 finger pricks, one before the meal, probably one half an hour after the meal, one an hour after the meal. But who knows, maybe the blood sugar didn't get all the way to the top within half an hour. And
Right.
then it started coming back down after 60 minutes. And so I think that the finger pricks just don't give you enough data points to have an accurate view of the right amount of carbohydrates for your body at any different season in your life. I do think that the finger prick is better from like when I'm not pregnant, when I
Mhm.
would do some extended fasting, and I would just kind of be curious, like, okay, I wonder where my glucose and ketones are
Right.
this morning, or I wonder where they are at 3 p.m. or
Mhm.
where they are at 5 before I'm eating. So
Right.
I think that's where I would use the finger check, is spot checking like
Right.
before the end of a fast. But continuous is so much more helpful if you're trying to dial in your nutrition. And I think it's also more helpful to see how exercise impacts your blood
Mhm.
sugar. I know it's so motivating to me to go for a 10 or 20-minute walk after I eat like a meal that has especially more carbohydrates than normal,
Yeah.
and see that blood sugar go down,
Yep.
right? The
Yep.
muscles are using the sugar and you're like,
Mhm.
okay, good. It's not hanging out in my bloodstream causing
Yes.
inflammation.
Right. Right. Yeah, for sure. No, that's such good information. Thank you for explaining that. I think that's helpful.
Yeah.
When you're looking at like the signs of insulin resistance, right? And you said there's like this period of time that there's like a buildup period for full on diabetes. So we're looking at the signs. And I find this is true with a lot of things, but I want to know your take on specifically the blood sugar conversation. What are some things that we might be contributing to like normal signs of aging that
Oh, yeah.
actually should be concerning for insulin resistance? And then, what could potentially happen after that?
Yeah, so many things. First of all, I think that people assume being sick in some
Mm,
capacity is normal. I think people assume gaining weight is a normal part of aging. It doesn't have to be.
right.
And there are different strategies we should adopt to preserve our muscle mass as we age. But I mean, fatigue is one, I think, especially in midlife, if you're having low energy levels, if you're having some poor sleep, fluctuating energy levels throughout the day, that's not necessarily a normal part of aging. Another
Mhm.
is joint pain. So insulin resistance happens at every single cell in the body. No cell is protected, including the cells of your joints. So, like the cartilage cells lining your joints that are responsible for producing cartilage to keep the joints like smoothly, rolling against each other. When those become insulin resistant, they don't produce the cartilage as well. And
Mhm.
then when the synoviocytes inside of the joints that are supposed to produce the fluid or the grease for the joint, when those become insulin resistant, they produce an inflammatory substance, not synovial fluid as well.
Wow.
So, like joint aches and pains can be a sign of insulin resistance that's often attributed to aging.
Yeah.
Weight gain, especially for women around menopause. So when a woman goes through menopause, her body becomes more insulin resistant because estrogen has a protective effect against insulin resistance. Essentially, it makes insulin work better. So we
Right.
need less of it.
Right.
And when that estrogen tanks, insulin resistance goes up. And so that can contribute to weight gain and an increased risk of heart disease. That's why women have a lower risk of heart disease before menopause
Right.
than men, and then it equals out after menopause. And there's other stuff we can get into about menopause, but kind of opens up another can of worms. I think the point is it goes up after menopause and you need to change your strategy. Like if you're like, oh, I'm not eating any differently and I'm not exercising any differently and I gained 20 pounds, it's like you can lose those 20 pounds again. It's just going to take a different strategy
Right.
than what you did like in your 40s and your 30s.
Yeah.
So yeah, weight gain, but a lot of people just, again, they assume they're going to need medications. They assume they're going to get a little bit sick. High blood pressure is often the first sign of insulin resistance, even before high blood sugars. So many of our members, yeah, they're on high blood pressure medication, and then they might be on that for a little bit, and then their blood sugar is starting to creep up too. Then they need a blood sugar medication, then they're on a statin. That's actually how I kind of discovered insulin resistance, was when I was reviewing all the charts for my geriatric patients. I said, why doesn't somebody just have diabetes?
Right.
Why doesn't someone just have heart disease? Why
Yep.
are all these 70-year-olds on all three of these
That's so true.
all the time? Well, there's a common cause. So high blood pressure, high blood sugar, high triglycerides, excess belly fat, low energy. Those are going to be the big signs and symptoms.
Yeah. That's so fascinating because when you were saying, I was thinking to myself, like anybody that I've known that has type 2 diabetes doesn't just have type 2 diabetes. And the blood pressure and the cholesterol thing almost always go together. So, okay, so if we're looking at, so let's talk about specifically the high blood pressure part, because I feel like this is super common and doctors it's such an easy thing to recommend, high blood pressure medicine, all that. So say somebody has high blood pressure, they go get a test, they have high blood pressure. What should they be doing? Like if they want to go like the non-medicated route, what should they be doing to get their blood pressure back down? Is it like address it via the blood sugar situation? Like, what do you recommend?
Yeah, I think that's the nice thing about what I teach. I teach a low insulin and inflammation lifestyle because it kills the most birds with one stone. It's like if you have a rifle. Well, I don't really hunt. I think it's a shot. Isn't it a shotgun
I don't either.
that
You're
has
asking
like
the wrong
multiple
person.
bullets?
Yeah, that sounds right.
So the shotgun has the multiple bullets. That's like what the lifestyle is, right? Like
Gotcha.
you're gonna get the most birds with one shot.
Mm-hmm.
I've never been a hunter, and it's funny. But when you live this lifestyle, your blood pressure is going to come down. Your weight's going to, come. Most people need to lose weight. So come down.
Right.
Your blood sugar is going to come down. Your triglycerides are going to come down. Your energy is going to go up. Everything gets better because everything has that same underlying cause of high insulin and high inflammation. So if someone has high blood pressure, the first thing that I would do is reduce sugar intake. If you're drinking a lot of pop, if you're eating processed foods, if you're eating candy bars, those are the things that are the lowest hanging fruit,
Right.
will have the biggest impact. So sugar will raise your blood glucose. That will raise your insulin levels. And then high levels of insulin have this hormonal effect that causes water retention and raises blood pressure.
Yep.
So if we can really reduce the volume, then we can help reduce the blood pressure. So reducing sugar intake is huge. Replacing that just with plain water, like hydration, is very important. The other thing that I would prioritize there is protein. I think it's a lot easier to reduce your sugar intake when you're getting adequate amounts of protein.
Yep.
So I typically recommend 1 gram of protein per pound of ideal body weight. So look at a BMI chart, find your height, find like the green zone for your weight. And then if you're a little bit nervous about getting that much protein, like pick like on the lower end of the healthy range, whatever that amount in pounds is. Like for me, it's 140 pounds. So 140 grams of protein is my goal every day.
Yeah.
That's going to help you with the sugar craving. So that's where I would start, would be protein, reduce the sugar, bump up the water intake for somebody with high blood pressure.
Yeah, that's it. And it's so simple. Like I'm not saying it's easy because, you know, it can be harder for some people to do those things, but it's so simple. And I feel like we make it so complicated, which of course is why everybody's so quick to be like, oh yeah, I'll just take the medication because it's like the easy
Yeah.
way, you know, whatever. But it's so simple. Like these are things you're saying are nothing that everybody listening has I've never heard before. Like these are simple things.
But I think that sometimes when we listen to podcasts or we read books, we're looking for new information and
Yes.
we need to change how we learn. And
Yes.
instead think of like, well, I know that already. It's like, but are you implementing that?
Exactly.
How
Mm-hmm.
consistently are you implementing?
Mm-hmm.
So I say like, let's be a student of ourselves and of our own behavior and learn our own food triggers.
Yeah.
I just think that's way more beneficial to learn from your own experience than try to continuously just like flood your brain
With new
with
stuff.
with
Yep.
new stuff, with more
Yep.
information. It's like
Yep.
act on what you already know
Yeah.
first.
Yeah,
Yeah.
for sure. You know the basics. Yeah. Well, and I think sometimes too, especially the protein piece, I have this conversation all the time, especially when I'm working with like menopausal, postmenopausal women. The protein piece, they think they're eating enough. And I'm like, let's track your food for a little while. And it's like, oh, you literally are eating like 80 grams of protein a day. Like, no. So I think sometimes too, you just don't know. You think you're, you know what I mean? It's like, yeah, it requires a little bit
Like
of,
the Subway sandwich. Yeah,
yeah,
like you
right.
think you're eating.
Exactly.
Well, what are you
Exactly.
having for breakfast? I have 2 eggs and a piece of toast. I'm like, that's
Yes.
like
My
maybe 50
gosh,
protein.
yes. I had that exact conversation 2 weeks ago with a client. She told me she had 2 eggs. I'm like, you know how much protein 2 eggs is, right? It's like 12. Like, what? Like, you just don't know
Which is
what you don't
less
know.
than half, by the way, of
Yes.
what I would recommend for breakfast.
Yes, for breakfast. Totally. Yeah. That's crazy. Yes.
Mhm.
So everybody out there, 2 eggs for breakfast is not breakfast. So that's that.
Yeah, that's a snack.
Exactly. Exactly. Okay. The other thing I wanted to ask you about, because I know it's like such a trendy topic. But like the GL, you mentioned before, the GLP, like all of these medications and stuff. And so, like, yes, this is kind of like this quick fix situation that is helping some people. And like you said, some people do need to lose weight to get their blood sugar down. So, like, okay, there's that component. But what do you, I guess, your take on that in terms of like long-term effects of things like that?
I think the verdict is yet to be out. I know a lot of people who have taken GLP-1s, people my age, people who some of them had more weight to lose, some of them just wanted to lose a little bit of weight, spending a lot of money on these drugs. And I think the verdict's out. I think that we have to see where they're at in 2 or 3 years, see if they sustain that weight loss. My big concern is that you cannot circumvent the required lifestyle changes that it takes to keep the weight off.
Right. For
You
sure.
can take medication that will augment your feeling of fullness and cause you to eat less food, and then you will lose weight temporarily. There have been known to be rebound effects when
Mhm.
you stop the medications, rebound hunger, rebound eating. And there's a risk that if you are so full and you're not eating enough protein, you're absolutely compromising your muscle mass when you're losing weight.
Mhm.
You're losing more muscle as you're losing weight than you would otherwise if you were following like a high protein, higher
Right.
calorie, not like a high calorie
Yeah,
diet,
yeah,
a
yeah.
high calorie diet.
Yeah.
And the weight that you lose is going to be harder to keep off because you've lost muscle mass, meaning you've
Mhm.
lowered your metabolic.
Metabolism. Mhm.
So I think that the verdict is yet to be out, at least in my friend and family circle. But I am a big believer. It's just sad. Like I'll see them taking these medications and they're not really changing what they're eating. They're just eating
Mhm.
less of it.
Yep.
It's like, this isn't going to work.
Yeah.
It's
Yeah.
going to work long term.
Yep. Yep. Yeah. And I mean, it's true with a lot of things, right? I mean, the GLP-1s and then even people who do other type of surgeries or treatments where it's like, okay, yeah, you did the
Mhm.
whatever for, or like the people that do gastric bypass, that kind of thing. And not like shaming anyone for doing these things. But again, if you haven't learned how to change the behavior that got you there in the first place, it's like, okay, is it, so many people have I don't know if relapse is the right word, but they gain the weight back or they have issues.
Yeah.
Yeah, yeah. They have issues with, their surgeries or that. So I agree. And I think it's sad too. And it just, I don't know, it kind of worries me for like talking about how it destroys your metabolism when you're losing all that muscle. Like, what is that setting you up for in 10 to 15 years when, like, to your point, I talk about to this about women all the time when your estrogen drops and now you know, it's like you have a harder time holding on to muscle mass as you age as it is. Now you just
Mhm.
ate it all away because, you know, it's just, I don't know. I worry about that part too. Like people's metabolisms, like what is it going to be like in 10 years?
I think it's another interesting point is that when you take, I don't want to call it a shortcut, but like,
It is. Let's
let's
be
kind of
honest.
call a spade a
Yeah.
spade. Yeah.
Right.
You're robbing yourself of the opportunity to develop the self-confidence and the
Mm,
self-esteem that you get when you follow through on lifestyle
that's a
choices.
great point.
Taking a medication does not boost your self-esteem,
Hmm.
but learning how to say no to that glass of wine, learning different coping mechanisms
Right.
to deal with the stress that's
Hmm.
causing your emotional eating,
Hmm.
that will raise your
Yeah.
self-confidence. That will raise your self-esteem. Those are those soft skills that are required for weight loss maintenance too.
Right.
And I think that that's another side of the coin, that mental and emotional aspect of behavior change that those medications, they don't address. And
Yep.
so I think that we're doing a disservice to people to just say, take this medication and you're going to lose weight and you're going to be so happy. It's
Mm.
like, a lot of times the physical weight is a symptom of mental weight.
Yep.
And I like to say, like, if you think losing weight is going to make you happy, like go put a backpack on with 25 pounds in it, walk around for 5 minutes, and then take the backpack off. Like, tell me, are you happier?
Hmm.
No, you're just a little bit relieved that some of that weight is off.
Right. For
And
sure.
then it's
Yeah.
easier to walk and breathe.
Hmm.
But emotionally, you haven't really changed.
Yep.
So we can't discount the benefits of a healthy lifestyle for your mental and emotional health too. And
Yeah.
that's
Yeah, it is. I mean, those are the the parts that typical Western medicine doesn't really help us address. And then those
important.
are, I mean, you can't ignore those parts. So yeah, I
As
agree with that.
reading into your background, I'm like, okay, she'll be like, she's on board with the holistic,
This is
mental.
my jam. Yeah, this
I
is my
love
jam.
it.
Yes, yes,
Yes,
no,
I love
100%.
that.
Well, yeah, and I did a podcast a couple hours ago for another gal's podcast, and we were talking about that. It's like you can't like we talk about how Western medicine, like it compartmentalizes the body and it
Mhm.
separates the mind and the body and all that. But then I find too, like I was telling her, you can do holistic routes that do the same thing. You can go to functional practitioners, do the same thing. If you're not addressing that mental emotional piece, but you're just doing it with, supplements instead of medication, you're still missing that mental emotional piece. Like you can't leave it out.
And I don't want to say this to come off as judgy, but all of the people that are my age that I know that are taking those GLP-1s, they struggle deeply with anxiety.
100%. 100%.
With depression. And so I think that that's just kind of an example of that that's another opportunity for them to naturally grow in their own mental resilience and strength and self-esteem that they're not giving themselves the opportunity to experience.
Yep.
And I don't want that to sound mean or anything. That's just kind of my honest opinion on
Yeah,
it.
no, I don't think I mean it's facts. I agree. I don't think it sounds mean at all. I think it's definitely a perspective shift for a lot of people. And I think too it could be a wake-up call to a lot of people like, "Oh, this is why I keep going back into this pattern and why this like it's true." So, yeah, I cannot agree more. So, when we're looking at okay, so we're recognizing the symptoms when we're, 10, 20 years before it would have happened, right? That diabetes would happen. Recognize the symptoms. We're checking our insulin, fasting insulin, and all that. What are some things that as we age, like especially because we've been talking about what happens as we get closer to menopause, into menopause, and estrogen isn't protecting us, blah, blah, blah. What are some things we can be doing besides the diet piece that you've already talked about that can help with, like, are there other lifestyle things that we can do to help with healthy insulin levels?
Absolutely. So following a low carb, high protein, high healthy fat, high fiber diet, that's going to be so great for you. Really moderating the carbohydrates, especially and focusing on high protein. Hydration. When you're dehydrated, your blood's more concentrated, so your blood sugar levels are going to be higher. Physical activity is very important. I think that a couple really good forms of physical activity would be regular movement throughout the day, especially after you eat,
Mhm.
especially if there's carbohydrates in those meals. Going for a walk after you eat is actually a really good way to help manage your blood sugar. And then strength training, because moderate to high intensity strength training, all major muscle groups 2 to 3 times a week, that is going to protect your muscle, keep it healthy, keep it strong. That way glucose has a place to go after you eat it from carbohydrates instead of being shuffled off to your fat stores. So muscle mass is important. Sleep, really reducing stress, and there's mental stress, emotional stress, toxins, environmental stress, but sleep deprivation is also a stress on your body. So I always recommend those amber colored blue light blockers, to block the blue light from a phone or a tablet or a TV at night. That's going to help your melatonin naturally rise, so you don't have to take a melatonin gummy that has like 5 grams of added sugar in it
So
before
true.
bed. Just put your blue light blockers on and block it naturally. Not eating before bed, not eating 3 hours, 4 hours before you want to be asleep. That's a really good habit to develop. And then a lot of mindset and thought work, I think, is so helpful. The most important piece, because your thoughts will drive your emotions will drive your actions will drive your results. And so instead of just focusing on the result, let's work our way back to the cause, which is how are we thinking and how are those thoughts impacting our choices?
Yeah.
But I think, like, journaling is a great technique for that. My favorite technique. Meditation, I think, can be very helpful for that. So
Yep.
those would be kind of the pillars, nutrition. Intermittent fasting, of course, is a great strategy. That's a whole nother topic. I typically recommend 12 to 14 hours a day is a pretty good recommendation for everybody, regardless of life stage. Fasting, nutrition, physical activity, stress, sleep, mindset. Those are the big ones.
Love it. Those are great. And again, nothing you've never heard before. Like these are all like back to basics kind of thing. I love it. So simple. Okay, so the hydration thing, I learned so much when I had gestational diabetes, and that was a big one. And I've always like hydrated a lot, but I don't know if like typical pregnant women need to hydrate like so much more, but I found like that was a big thing that would affect my blood sugar so much. Was I would think, I mean, I'd be drinking water all day, and you already have to pee more because you got something weighing down on your bladder. I'm like, I could not drink it, but that was a big one for me, the hydration piece. I'm like, oh, this really is affecting my blood sugar. When I prick my finger, I'm like, oh my gosh, the hydration piece was that was a surprising one to me, like how much it actually affected what.
Well, your blood volume increases like what, up
Yeah,
to 50% or something when you're pregnant.
that
And
makes so much sense. Duh.
you
Yeah.
have so much volume going through
Yes.
your body. I'm thirsty. I need to get more electrolytes still, but that's been helpful for me. And
Yes.
yeah, I really like the LMNT ones, but the
Yeah.
price tag is like $2 a pack. And I'm
I
like,
know.
gosh, you guys are killing me.
I
Why are you
know.
so
I
yummy?
know. I know. My go-to is Redmond Relight, which is no cheaper, but
It's
it's so
not
good.
cheaper.
I mean, I buy the little tub. So I think it probably is a little cheaper than like the
Okay.
individual packets. And I buy like the tub of it. But I like it. But I like the ratio better. I like the ratio to sodium potassium better than the element two ones. But yeah, it does get, I know. It's like, but I
Are
need
they
my
lower in
electrolytes.
sodium then than
Yes, they
the?
are. Yes. Yeah, so I like that. But yeah, no, I get you. It's yeah. The hydration one got me. And then here, this is like a personal question, but I love to hear your thoughts on this. So when I had gestational diabetes, I was very, sticking to the diet was no problem for me. My doctor was like, "Oh, we need to do all these checkups to make sure." Like, no, I got it. I know how to stick to a diet. I can do it myself. I don't need to keep going seeing the specialist. So at night, I would have to eat because the issue I had was in the morning, my blood sugar would be so low. And so she was like, "Okay, just eat like right before you go to bed." So I would have to, I'd literally be sitting in bed with like a snack and I'd eat right before I go to bed. And sometimes still, and I don't know. So I don't know if, so I guess my question is, because I have had clients too, where it's like, oh, I wake up in the middle of the night, like starving, and my blood sugar is waking me up because I'm hungry and my blood sugars drop. So like, what are your thoughts on that? And like, if there's like super steep drops at night, or I don't know, what are your thoughts on that?
How low were your blood sugars going in the morning?
I can't remember the exact number. I just know it was a good like Because what it's supposed to be like 90 in the morning. Was it supposed to be in the morning? I forget what it's, or 75, maybe it's 75
I mean,
morning. I
quote
forget.
unquote normal is like as low as 70, but my blood sugars overnight get under 55 when I'm not pregnant.
Yeah.
I have to turn off the critical low alarms on my
Because it'll
GPS.
go up.
Otherwise, it's just the most annoying thing.
That's so funny.
So I think a lot of people go by the number instead of like
Mm,
a symptom. So, and then
gotcha.
my other question, was there a symptom that
Yeah.
corresponds to
No,
them?
there wasn't a symptom. It was just like she didn't want it to have these big like drops and then it would spike. Because then when I would eat breakfast, it would like spike a lot. And so it was like, can you not have it so low in the morning so it doesn't spike as much after you eat? It's like that situation.
Well, to me, that doesn't like, to me, it's like, well, why would we want higher blood sugars just so that the post meal
The spike isn't back. Right. It's very true.
right? So I'm like, I'd rather see
Yeah.
them start at 70 and go to 100 than start at
Yeah.
100 and go to 130.
Right. Right. For
So
sure.
to me, that makes a little bit more sense. And
Yeah.
I do hear that, like where people are hyper focused on the number. Like I
Yeah.
want someone to ask me like, so should I wait until my blood sugars are, and I've never even said this. It was like a YouTube comment during like a live training.
Yeah.
And they're like, well, should I wait until my blood sugar monitor says 95 before I should eat again?
Exactly 95.
And I'm like, I don't know where you're getting that from. Like, are you even hungry? Like, how
Right.
long ago did
Right.
you eat?
Yes.
So I think that when we're talking about low blood sugars in the morning, we have to recognize that quote unquote normal range is as low as 70.
Mm,
And mine get far lower than that. And
hmm.
I'm totally
And you're
fine.
fine. Hmm.
Totally fine.
Yeah.
And it's very person specific. And then we can't just look at the numbers because any glucose meter also has a margin of error.
Right.
So we have to take that into consideration.
Yeah. That's a good point.
And your symptoms, like, are you just ravenous in the morning? Like, how many carbohydrates were you
Hmm.
having in the morning? What was the order of food that you were eating in the morning? Were you getting any
Yeah.
fiber with that breakfast? There's so many things that I would have troubleshot first.
Hmm.
I would have recommended, let's sit in bed and have a snack.
Yeah.
It's
Right.
doing our best. Like, I'm like, well, there's probably some other
Oh,
questions we can
I
ask.
know, I know. And that was like, I was such on a regimented schedule of like, I have to eat at these times so that my blood sugar stays here. And it was just, yeah. I mean, granted, I also think there's like a level of stress because you're pregnant and you're like, well, I don't want to like mess anything up. And then, so it's, yeah. But I was just curious because even I've had people even who aren't pregnant who are like, oh my gosh, I wake up in the middle of the night and I'm starving. Or in the morning, it's like, I'm so hungry, I'm so starving. So it's like, okay, well, what do you do about that blood
I
sugar
think it
wise?
depends on like, well, their blood sugar may not be like that low.
Low.
And if they're in an energy deficit to try to lose weight, like a certain amount of hunger is to be expected.
Right. That makes sense. Hmm.
So we kind of have to deal with that
Yeah.
through extra hydration, like maybe some tea or coffee,
Hmm.
but really looking like, are we at too much of a caloric deficit to where this is like a miserable experience for you?
Right. Right.
That's kind
Yeah.
of, there's a lot of different things that I would troubleshoot
Yeah.
there.
Yeah. That makes sense.
Yeah.
That makes sense though. And I mean, I like your point about not like being too much of a stickler on the number versus the symptomology. Like look at the symptoms and how your body, well, and I think, it's just like everything else, understanding how different everybody is. Like everybody is different and people are going to feel things differently and a certain blood sugar level is going to feel different in one person versus
It's
another. And yeah.
because if people, like I've worked with people who have very severe diabetes and they feel like they have low blood sugar when it's like 180.
Oh gosh. Oh my
Um,
gosh.
if their normal state is like in the 300s,
Sure. That
like
makes,
so think
yep.
about that,
Yep.
like that's,
Yep.
I mean, if my normal blood sugar state is 100 and I'm down at 50, I'm
Mm-hmm.
probably going to feel like crap. If
Mm-hmm.
their normal blood sugar is 300 and they're down by 50%, they're at 150, they're probably going to feel like crap.
Mm-hmm.
That's a really good point.
Yeah.
That
No, I've
really,
heard that before. One of my clients at my studio is an endocrinologist, and she's told me stories about people come in, their blood sugar is like crazy 500 something, but they don't even feel anything. And I'm like, how are they alive? Like it's crazy.
I think we'd be like,
I
"Ooh," like,
know. I would
like,
probably like be having a panic attack or something. Like, yeah, no, it's crazy. But yeah, I mean, I think it is important to recognize like everybody's gonna experience it, right? Yeah. So I love that. Okay. So as we wrap up, I feel like I could talk about this for so long. There's so many things I want to ask you, but as we wrap up, I do have one more question I want to ask you, but can you let everybody know where they can find out more about you? And you do so
yeah.
much education and just teaching and all of that. It's such a good resource.
Yeah, so we have a podcast. It's called Reshape Your Health with Dr. Morgan Nolte. That's a nice combo of expert interviews and then mindset tip episodes. On YouTube, you can find me at Dr. Morgan Nolte. Again, you can find those expert interviews, but then a ton of blood sugar tip, like quick tip blood sugar videos. Our website is zivli.com, Zivli.com. What that means is Ziv means to live in Croatian. And then the LI stands for low insulin and low inflammation lifestyle. So Zivli.com, they can find a free food guide there. They can learn about our program there, see all of our past, podcasts and YouTube episodes and stuff like that.
Love that. Perfect. And of course, the notes, all that will be, or the links, all that will be in the show notes. So I can check that out and go learn. Like I said, so many good resources there. So y'all go check all of that out. The last question I want to ask you that I like to ask everybody, what do you think is the most important thing you can do to live with purpose?
Oh, I always love these like ender questions. I don't do that on my podcast, and I wish. Okay, I want you to ask it again, and as you ask it, I want every listener to also contemplate their own answer. Okay, so ask it one more time.
Okay. What do you think is the most important thing you can do to live with purpose?
I think for me, it's living in energetic alignment. So it means creating the space, mentally, physically, and time-wise to be able to ask myself, what do I want? Like, what is in alignment with my deeper purpose? What is an energetic alignment for my day? And really honoring that and staying in energetic alignment with my deeper purpose and my values. And so if we're thinking about like, what's the number one thing that you can do? It's like, I read a book, I think it's called Essentialism by Greg McKeown. It may or may not be in that book, but the line was something like, our number one priority should be to protect our ability to prioritize. I really liked that. So I would say, like, if I'm just going, running ragged, not taking time to reflect and be like, is this the direction that I want to go? Is this the speed that I want to go? Then I'm going to find myself living for other people and living into other people's expectations and being reactive instead of living with intention and purpose. So living in energetic alignment and creating this space to understand what that means for me. And it's going to be different for everyone.
Yeah, I love that. That was a great answer. I love that answer. Thank you for sharing that. I feel like I've read that book before too. So yeah.
It's a good one. I thought that was a very good one, especially for people who have a hard time saying no, for people pleasers, for people who just feel like their life is chaos. I'm not saying that was me. I love books like that. One time I got the book, The Celebration of Discipline, and it's like a spiritual book. And my husband was like, that is the last book that you need. I was like, I don't know. I could learn more about discipline.
That's it. That's hilarious. You can never learn too much about that.
I know. Great. So thanks for having me. This was a really fun one.
Good. I'm so glad. Thank you so much for sharing this. And y'all go check out Dr. Morgan's YouTube channel, all the things, and start learning healthy blood sugar levels now so we don't have to worry about it when we get older. I love this conversation. Thank you so much for joining me and sharing all of this today.
You're welcome. Thanks for having me.